Good afternoon, everyone. It's a great day and glad you're with us. This session is Knowing Our History, Exploring the Past and Future Directions of Disability and Aging in California. My name is Sandi Fitzpatrick, and I'm the moderator for today's session. The next slide will show you our three experts who are going to be commenting on the history and making their predictions for the future. So we'll reflect a bit on the evolution of disability and aging services in our state. We'll hear from Darrick, Eli Gelardin, and Debbie Toth. That's going to be a lively discussion. And then we'll allow some time for audience questions, reactions, and your perspectives. Next slide, please. So the Master Plan on Aging, as you all know, it's the focus of the Senior Rally, was released in January of 2021. And we've got some experts on this panel that know this project intimately well. So the MPA did include a document. It was tucked in there very deeply that chronicles the evolution of aging and disability services. The Department of Aging hired a Master Plan on Aging historian. That was me. And my work was to capture that information through research and interviews in order to put together a 65-page document that looks at this history from both a federal and state perspective. We're not going to do all 60 pages today. This session today is going to focus on that trajectory and where there was and is intersection between the disciplines. Next slide. So the most of the presentation is going to be decade by decade, but it'll start with a bigger years to look at. And essentially when I think about this, I think about the fact that the goal to successfully age in one's community is in part the result of preceding decades of federal and state leadership, implementation strategies, and on-the-ground advocacy. And that's the kind of the overview of this. So in the 1900s to 1969, there wasn't a lot of focus really on aging policy or disability policy around the world. In California, you had the Department of Social Services, the County Welfare Directors Association, the Department of Rehabilitation, and the California Commission on Aging all established. They may have had different names, but they were started at that point. On the federal side, the biggest piece was the Social Security Act, of course, in 1935, the first White House Conference on Aging in 1961, and with that came Medicare, Medicaid, and Older Americans Act. One of the big overarching of this year was the birth of the first boomers and how they have been our rallying cry for many years in terms of aging and disability services and what that impact has on the way we allocate our resources and assign our services. The next slide starts in on the decades. The 70s, women's rights and civil rights, anti-war protests. Thanks, Debbie, for smiling at that. So in California, we saw the very first Center for Independent Living started in Berkeley in the nation. The area agencies on aging formed along with their advisory councils. The Foundation for Independent Living Centers and the Association of Area Agencies, those bodies formed at the same time. Department of Aging was designated as well. Disability Rights California had a governor's designation, and some of our care management programs were just started as pilots or demonstration. Homemaker Chore, ADHC, MSSP, and ONLOT. The federal level, you had the Rehabilitation Act of 1973, and the non-government entities were the National Association of Area Agencies on Aging formed, and Gray Panthers, a nod to the Black Panthers by a woman who just didn't want to retire at age 65. The next slide. 1980s were the Cold War, hands across America, and the Rubik's Cube. California led the way on Nursing Home Patient Protection Act after the Little Hoover Commission did a surprise audit at many of our nursing homes, discovered sort of horrifying or deplorable situations, and the process unfolded to create this law in California. It was mirrored several years later at the federal government with the Nursing Home Reform Act. The Older Californians Act was formed in 1980, along with the community-based service programs. So exciting at the time, but all funded with state general funds, and we know that to be a real nemesis or disadvantage as budget cycles unroll in the future. The National Council on Independent Living was developed at the federal level. The next slide. We moved to the 90s, where we had the first baby boomer president in Bill Clinton, the Hubble telescope, Harry Potter, and the internet. In California, we had public authorities established to help people find their caregivers. The California State Independent Living Council, SILC, was actually designated by an executive order, though it had existed previously under Department of Rehab as an advisory body. There was statewide planning for the baby boomers, including Senator Vasconcellos' long-range plan for an aging California. Skip that. On the federal side, big news in terms of disability rights. The Americans with Disability Act, the Olmstead decision, both changed the trajectory in many ways of our thinking, our philosophy, our respect of, and the way federal programs unrolled in the next 2 decades. You'll see that in a minute. Under non-government, can you go back one? Under non-government, 6 aging and disability organizations, for the first time ever, formed a policy document called The Challenge is Clear, the Time is Now. And that's that first really tangible piece of evidence of the 2 organizations coming together. Throughout this decade, the Coordinated Leadership Conference, initially bringing together CWDA and C4A, but ultimately expand into a larger role for aging and disability providers, advocacy groups to come together. Now go on. Thanks, Nancy. The new millennium, the baby boomers turned 60, but it was also California's decade of deficits. Facebook started as well. In California, we saw the elimination of most of the older Californians Act programs, and we've not recovered from that loss. There were calls for Health and Human Services to reorganize, restructure, re-something. But there was also the Aging and Disability Resource Connection program started in California in 2004. The California Community Transitions Program. SILC and the Commission provided a series of joint meetings. Eli, you remember that, as does David Wilder, I'm sure, was kind of his brainchild, picking up where the Coordinated Leadership Conference left off, and California established an Olmstead Committee. Federally, we saw, I think from Olmstead decision, we saw the federal government start to think differently about how services should be operated out in the community, how they should be consumer focused, how they should offer choice. And those top 2 programs top 3 programs are examples of that. Also at the federal level, the Medicare Modernization Act gave us prescription drug benefits under Medicare and preventive care services, and the Family Caregiver Support Program started. Go ahead, Nancy, to the last decade. So 2010, 2019, we had the Ice Bucket Challenge, iPad, and a renewed activism. California had the hope of a master plan for aging, and then we struggled to figure out what in the heck was a coordinated care initiative, how it was going to benefit people, and what was going to be its real impact. Federally, we saw the Affordable Care Act and the creation of the Administration for Community Living, setting a new paradigm at the federal level for aging and disability programs to be operated under one agency. I wanted to call out too the non-governmental focus. While most of the study that I did was on government services, I had to include what was happening outside of government as it influenced our success or our progress. That included the California Collaborative, yay, Maria and Nancy, who are on this call, the CADA, and AARP's Livable Communities, setting out to find community living for all individuals. And the next slide. When I look back, here's what I see as those federal influences. The impetus for both networks began in the 60s, and the federal government's role in long-term services and supports cannot be overstated. Since 1965, the Older Americans Act has been the backbone of aging services nationwide. And after Olmstead, a series of federal initiatives streamlined process, improved access, and implemented consumer-friendly systems, and that became our verbiage. California began the management of long-term care services and support programs to support community living. As I said earlier, go ahead, Nancy, the creation of the Administration for Community Living changed the paradigm. Under state influences, the core functions of the area agencies and ILCs have remained fairly constant. California has good years marked by program expansion, often led by governor's initiative, often with short-term general fund appropriation, and with that comes the budget deficits that erase or eliminate those types of programs. State general funded programs were eliminated in 2009 and have yet to be restored. The beginnings of the area agency and ILCs occurred almost simultaneously when you look back at history. The area agencies were the result of government regulation. The creation of ILCs was personally motivated to ensure that all people have control over the choice in their lives. 33 area agencies in California, 28 ILCs, and their respective member associations formed at the same time. Collaborative ventures started in '95, and we've seen them grow and blossom in recent years. One more, thank you. So cross-cutting. Over the years, I think perceptions have changed. Older adults were once considered the deserving poor, and Older Americans Act was given as to alleviate that. Well, then older adults became the greedy geezers, and the perception of disability has undergone change as well. An older adult is no longer aged. Aging is a verb, not a noun. The descriptor person with a disability has replaced handicapped. A master plan on aging became a master plan for aging. Efforts to combat isms will have to continue. Changing demographics and preparing for the baby boomers was our rallying cry for aging advocates for many years. That failed to get us that commensurate increase in dollars and service resources that we thought we should have for that. By 2030, the older population will increase and become more diverse, both economically, racially, and ethnically. Older adults comprise 42% of the disability population. My famous line from a Senate subcommittee hearing many years ago, the intersection of demographics, disability, and longevity have never been more apparent. With that, the next slide, please. So now our experts. Think about, I know that was speed reading from 1900 to 2019. So what I would like is for you to, I think we have enough time. Oh yeah, I went pretty fast, yay. So we have enough time, I think, to do one round at what were your reactions and thoughts, what stands out as significant development, pretty quick, because I really want you to focus on that second question and the second round through, where do we go from here? Darrick, your reactions, thoughts, and significant developments.
Hey, thank you, Sandy, for inviting me to this panel. So I'm speaking as a professional who had experience working in City County of San Francisco when I worked for the Area Agency on Aging from 2002 to 2005, was part of the movement to integrate aging and adult services. And then also as a former federal project officer who worked for the former administration on aging and then evolved into the administration for community living in 2012. So I think the timeline accurately capture everything, but I think it's more like a reaction to the growing unmet needs during different time frames. I am so pleased to see that we have the Olmstead, we have the Rehab Act, and that's more a advocacy effort from the disabled community, and that's really important. So if we look at disability and aging as a life kind of process instead of categorical, then I think it makes sense really to look at merging aging and disability services, and it's a matter of time. It took the federal government so long to do that, way after local counties in California did it. California started with, say, for example, San Diego, and I think they had a great aging and independent services way back, in the, I think, early 1900s, 1990s, I'm sorry. And then San Francisco copied that model in early 2000. And so it's not something which was very common because I think, as you may be aware, California has 33 area agencies on aging. And so a lot of times we focus on providing senior services only. And it was an afterthought for some of the area agencies on aging to think about integrating aging and disability services together. So I'm pleased that San Francisco at least follow the footsteps of some other counties like San Diego. And now I'm glad that's the California Master Plan for Aging, say it changed from Master Plan on Aging to Master Plan for Aging, because in addition to professionals representing the, we do have representation from the disabled community. And through some synergy, we're able to work something out together. And so one of the recommendations actually was to really pay more attention to aging and disability resource connection. And so I think this is really something the timeline has indicated the evolution of this change. So I'm pleased we are doing something about it, but we should not stop. We should continue this and just follow other states such as Washington, such as Oregon, such as Minnesota, because they are way ahead in terms of how to integrate aging and disability services before California. So I'd like to turn to other panelists for their feedback.
Thank you, Darrick. And you're right, in terms of the ADRCs and the potential increase in dollars for more further rollout of the network is included, as you said, in the MPA. Eli, your stab at those questions. Reaction, thoughts, significant, and future prediction.
Sure. So many thoughts, so many reactions, so little time. First, I think man, that's an amazing timeline. And it really speaks to the vibrancy and the complexity of aging and disability, and what these two communities, our two movements, have gone through over the last century, from where we started to where we are. And the work continues, as Darrick said. We look at what we've learned even over the last course of the year, the reflection that we've done around equity and social justice, the need to make our movements not just intersectional in terms of aging and disability, but also more representative of the broader communities that we serve. I also think about Crip Camp and Judy Heumann and Alan, who were young people when they started, Jim Lebrecht, I'm sorry, when they started, in independent living and the disability rights movement. They're baby boomers, they're seniors now, they're older adults. So independent living has aged, and older adults have aged into disability. So where we are today is really this cross section where there is so much more connectivity. And when you see models like the Aging and Disability Resource Connections, no wrong door, one door, whatever we want to call it, we're recognizing that as a community, we need to be more holistic in our approach to serve the entire community, recognizing that we all share the same needs, whether we're an older adult, whether we're a person with a disability, whether we're a caregiver or a family member. In terms of where we're going and the needs, obviously everything done in the master plan on aging and the opportunities for building a broader LTSS network are critical. But also, some of the overarching issues, climate change, racial justice, equity in housing in California. I think these are really broad systemic issues and barriers for the entire state and for the entire country. And we as advocates and we as service providers have a lot more opportunity to partner, collaborate, and create change over the next 10, 15, 20 years.
I like the positiveness. Debbie, it's all yours. Reactions, thoughts, significant, future predictions.
It's all mine. Woo! All right. Well, it's hard to express my frustration over the entire history when I'm listening to Darrick and Eli and being infused with hope, right? So it's hard for me. Let me like try and get back to the beginning of your presentations, like Sandi's talking about like decades and decades of then we built this and then we built that. And so each of these different programs and services and collaborations and things that we built and built and built, and yet when we hit crisis, the first place that we go is to pull the rug out from under seniors and people with disabilities. This invisible, discardable, disposable population is always at the front line when we're pulling out resources. So we spent all these decades building, right? Through civil rights movements, through advocacy, through, is there any more brilliant advocacy story than the mothers storming the Capitol and getting entitlement benefits for children with developmental disabilities? I mean, like there is this massive, wonderful, incredible history of building, and then there's just that moment where we dismantle it all. And I think, you know, I feel anger, and I feel resentment, and I feel sadness, and I feel frustration, but I also, at this moment in time, feel hope. Like, if you did that presentation and we didn't have the master plan and we were in 2018, I would be furious right now. But because we have this hope that's sort of percolating over here, things are happening. I was saying earlier, 32 total bills related to the master plan for aging. I have been at Choice in Aging for 19 years, and I can tell you in those 19 years, we haven't had 32 pieces of legislation in that entire period, let alone in 1 year. So, I mean, there's hope. It's happening. We have incredible leadership in Kim McCoy-Waite. Oh my gosh. Marco Meach, who is like he's at California Health and Human Services, and he is behind the scenes, and he is like the master of the puppet strings and not getting any attention whatsoever, and just making sure that all the right people are in the right places to make these things happen. So there's an infusion of hope for me. There's still a frustration. There's still a recognition that all of these things were built. If you look at, Sandi, when you were talking about the general funded programs that lost their funding, right? Because in the California General Fund, that's another easy way to go poof. I thought of the Alzheimer's Daycare Resource Centers, and I thought of linkages. And I thought of these two programs that were designed to help these people who are falling through the cracks, people with mid to late stage Alzheimer's and people with disabilities who don't need a medical intervention. They need care management. And in these two programs, we created evidence-based models that supported people. And then we pulled the funding. What, are these people cured, or did we just stick that knowledge in a box for a different century? Like, blows my mind. So it's like this constant battle with feeling excited and deflated. And I think if we want a lesson learned from all of this, it's that as you looked, Sandi, over all those decades and all the things that we did, what didn't we do? We didn't take all of those different puzzle pieces and put them together. Like, I don't know if you remember Gary Passmore's periodic table of elements that was really within your services, right? That document that showed you the 3,000 different places and spaces that we touch aging and disability on this chart. And it might have been just aging at that time because it was before we became family, right? Aging and disability became family. But before that, right? So we have all these different places and spaces. We did not put the puzzle together. And if we can learn anything, we need to be putting that puzzle together. It can't be that we have 32 pieces of legislation that all live in their own silos. They must connect to other pieces. As Kim said this morning, it's not just that there's one committee that deals with aging. Every single committee should have the lens of aging. And I think back to, you know, going through the master plan for aging stakeholder advisory committee process, and Darrick, you were there listening to former Assembly member Cheryl Brown, and I guess she's now commissioner with the California Commission on Aging. But the idea that you have to bake in, right? I think if we look at all of the things that we did in aging and disability, and then we tried to put them all together, we were trying to add the key ingredients to the cake after it was baked. Like, we've got to fix that piece of it, right? And I think that's our, that's my knowledge, that's my thinking on that. What I want to say is that we have this opportunity right now because it's so prevalent and in front of everybody. The pandemic has put a magnifying glass where we all saw what was happening before, and now the rest of the world is seeing it. And it's not just in the newspaper, on the TV. We're not just hearing it in the media, but actually, like, comedians are now talking about it. I don't know if you saw Bill Maher. It's rated R. There's some F-bombs and some various other things in there that are for adult audiences only. But he talks about ageism, like the accepted ism. Like, this is now everywhere. And I loved his quote was, "Is there anything more piss ignorant than not using old people as a resource?" Like, yes, it's being talked about, it's there. So all these things are in place. My prediction for the future is it depends on you. I'm going to tell you, with the master plan for aging, so much good stuff got baked into that. Transportation got discarded. Why? I don't know. But what I can tell, well, I have some thoughts on that, but I'm limited in time. So anyway, my point is that if we sleep, if we accept the status quo. If we go back to just saying these programs were great, but we're not putting the puzzle pieces together, then we will continue having this problem. And 30 years from now, they'll be on some different platform, on some spaceship somewhere, having this same meeting, talking about these same problems. So it depends on you. What are you going to do? Are you going to show up? Are you going to speak? Are you going to demand these services like they're an inalienable right? We aren't begging for breadcrumbs. We have proven cost savings and person-centric delivery of life-saving and life-lifting services. So let's just show up. That's my prediction.
Actually, I'll give Darrick and Eli just a moment or two to respond. But where the next problem will be is the fact that we're 76 million as baby boomers, and the millennials are 80-some million, and there's going to be providers going, "Oh my God, the millennials are coming," just like they went, the boomers are coming. Darrick, your last word in a minute or two.
Thank you. Well, I just want to have a word of caution because it's really great intention to have an integrated system merging aging and disability services together. I'm drawing this comment from my experience working under the Federal Administration for Community Living. Back in 2012, the intention was great under the leadership of Assistant Secretary Kathy Greene. She was able to merge several departments together under one umbrella. But then there's a change in administration, and then funding was kind of put somewhere else. And at the regional level, we have a depletion of regional staff. And also there was not enough and understanding or reason why this was being done, right? So after Kathy left. So I think for California to be able to do it, it doesn't only happen within this administration. We have to make sure that, as a collective, we want to see California walk this through from the beginning to the end. So that if we create an integrated department, there needs to be sufficient funding. Just like what's happening with San Francisco. When I was managing the Area Agency on Aging as the Executive Director of Department of Aging and Adult Services, which time the budget as of 2005 was only $3 million. Now is almost tenfold, right? Under the leadership of Shireen McSpadden. And she has recently accepted another position with another department. But it's great. That's what it takes to really have an integrated system which truly meets the need of communities. So that's the word of caution I have, that we want to make sure we continue to be strong advocates from both the disabled community and the older adults community so that California will have a true integrated system.
You hit on a point. My report looked a lot at the financial impact of good years, bad years, but it also is a political change in leadership that has, because we're so dependent, all of us, many of us, I guess, on those federal dollars to do it. And so, Eli, you get the last word, and then we'll open it up to any audience comments or questions.
I mean, I think Debbie and Darrick really hit it on the head. And just to trickle down on the advocacy theme, our networks have gotten much more sophisticated, coordinated, intentional about our messaging, about our relationships, not just at the state level, but locally with our boards of supervisors, with our local advocacy networks. And that is just a great opportunity for investment. Our leaders need guidance. They need technical support. They need to be educated on our issues. I mean, yes, we see the New York Times article on the terrible nursing home or, something in the local news, but we really need to educate at a very fundamental level our constituents, our communities, our electeds on our policy issues, what it means to live independently or interdependently. What collaboration looks like and why collaboration works, what outcomes you see, reducing hospital stays, getting someone through, the hospital to nursing home to home pipeline, saving money. We all thought COVID was going to hit hard in terms of recession. There are still recessions in the future. So the work we do now to demonstrate not just the social, but the economical impact of our services and make that case and build those relationships and build those legislative champions the better. And I think we are doing that. We've done a lot of good work, but the work must continue. And we also, and this is just my one other piece, we need to make sure that we are mentoring and empowering the younger folks. We need to share, I'm an older person now, we need to share our knowledge with the younger generation, the future caregivers, the future leaders. You know, I feel that's something, a source of pride in terms of disability rights, that we have been able to develop great mentoring. And I think we need to double or triple down on that to ensure that there's continuity, as, you know, whether it's baby boomers, Gen X, you know, millennials, Gen Z, you know, aging continues, disability and independent living continues. And how do we foster leadership at every level?
Perfect. And I love your more sophisticated, more coordinated, and more intentional. So if you could flip up the next slide, Nancy, it would be the last slide. And now it's your turn. There are 3 photos on this particular page. There's the logo for California for All. Thought that was very appropriate. There's an older woman doing crafts, but she's got a smile on her face and her thumbs up. And the last photo is an individual in a wheelchair facing away from the camera, open field in front and arms wide stretched, hopefully in victory. So we're open up for questions and comments, either in chat, the Q&A. I'll pull up the ones that are here right now, or signal me in some other way if you need to do that. So here's a question, maybe Debbie, you want to take this one? Your discussion about integration of services reminds me of a concept I worked with back in the 70s, 80s. Is case management an old-fashioned concept? Yeah, thanks.
Wow. Yeah, funnily enough, I was talking to the director of Aging and Adult Services in Contra Costa this morning about what a gap it is. So it's like having your own personal tour guide to your life, right? Because aging and disability don't come with a guidebook on how you navigate a system, and care management provides that. It provides the support that folks need. It's antiquated, it's new, it's current, it's old, it's everything, right? Because we just stop funding it and then we rebirth it and then it's new. You know, it is absolutely one of the most integral services that all of us should be providing. The one issue, other than funding, I should always say there's 2 issues, because funding is always number 1. But the second issue is, with care management, we have to have the supports and services to provide in care management. You can't just have somebody guiding you somewhere where there are no services there, right? So it's a piece of a puzzle. So the healthcare system does not meet everybody's healthcare needs, because we all know now healthcare happens outside of the 4 walls of a doctor's office or a hospital. And in so many cases, there's social connections that, and access to things that are all the difference in making our health come true. But if we don't have the transportation to get there, if we don't have the Alzheimer's support group to go to so I can keep my husband at home, like all of these things, right? We must have the services. So care management is an integral piece. It's a piece of the foundation, but we also must invest in a safety net so the care manager has a place to go with folks.
This is so exciting and interesting. I mean, we could do a whole hour on this one. Eli, I'm going to toss the next one to you, though there have been a couple of folks who have said thank you throughout it, one specifically calling out Darrick and one Eli. So this is from Jean. So beyond legislation and funding, we must assure creative and innovative technology be developed and utilized for allowing older adults to age in place. Should this not also be emphasized?
Absolutely. And even at a very fundamental level, I mean, we have so much work to do in just bridging the digital divide for both of our populations. I mean, we take it for granted that we can easily get on Zoom. We have the connectivity, we have the digital literacy, but that is a huge gap for so much of the populations that we serve. So starting with just continuing to work on building the capacity of our communities to navigate the internet, and recognizing that during this, you know, wild time, so much is virtual, not just service delivery, but also kind of going back to some of Debbie's comments, social connectivity, you know, creating as best we can communities and places where folks can be engaged, recognizing that for some, you know, even as we move forward towards reopening, whatever that looks like, there is still going to be so many folks who aren't going to be comfortable or who haven't gotten vaccinated and don't feel comfortable getting vaccinated? How are we creating our digital capacity to support older adults and people with disabilities? And just the last piece, in terms of technology, we have seen and are developing these great resources like ability tools. And there is more investment and more work we can do with, this is California. We have Silicon Valley right here with, with Silicon Valley to support aging and disability. It will be interesting to see what that looks like and how we leverage tools like Nextdoor or further build out the access capacity of transportation tools like Lyft and Uber and many others.
Thank you. I just found out that there was a dementia-friendly stove that's electric that shuts off, and I think I need to get that for somebody in my life. Cheryl Brown didn't ask a question. She posted a comment. Hello, Commissioner Brown, wherever you are. The more things change, the more they remain the same. And Darrick, I'm going to let you take this next question. If Governor Newsom is recalled, well, then that also assumes not elected, but how does the momentum from his master plan continue? Do you want to try that one?
Well, absolutely.
Okay.
Putting politics aside, I think it's very important for us two things going hand in hand. Number one is the local advocacy efforts, just like what Eli and Debbie talk about. We cannot stop now. We cannot stop forever, because aging and disability issues are really, really important. Sorry, I have my two dogs barking in the background. Aging and disability issues will continue to be very, very important for us to pay attention. So at the local level, we need to continue to push and make sure that this is not going to disappear from the radar. And then at the state level, we do have legislators who are elected representing us. And we need to continue to make sure that they listen to us, hear our voices, and also we need to explain to them why this is important. Because without an administration, we can still do something about it. That may change the context of the game plan, but the momentum should not stop. So that's my response to that.
Thank you. I know I didn't mean to put you on the spot. You certainly can't speak for the administration, but thank you for that. This question is from Janet, and I'll just look at the panelists to see who would like to take this one. Is there political will to really make the change needed? For example, AB 848 is in suspension now about concerns with its cost. The premise is to increase the personal living amount for NH patients from $35 to $80. Who here on this call wants to live with $35 a month for all personal needs?
I don't think anyone. I think this is such a small pittance. It's absolutely ridiculous. And NH in that case is nursing home. So in skilled nursing facilities, if you're on Medi-Cal and you're living in the skilled nursing facility, you have an allowance. I hate that. I hate that word. You have an allowance of $35 a month. And it is insane that we should expect anybody to have that amount of money. It's hard enough if you have to live in a skilled nursing facility. I think with California Community Transitions, having done this program since 2009 and transitioning hundreds of people out of skilled nursing and back into the community, we know that not everybody in skilled nursing facilities needs to be there, but it's bad enough if you have to be there and that's where you are living, that you have $35 a month to figure out some other way to bring yourself joy. And that, it's not right. It's not fair. Do we have a problem with cost being the issue at the forefront of everything? I will say yes, absolutely. And as long as we allow that dialogue to dictate our actions, then it will continue to be a problem. But bicyclists showed up in droves at transportation meetings when they wanted more bike paths. And the more of them that showed, the more we saw investments locally in bike paths. So as long as we allow them to say, no, it's a money problem, it will continue to be a money problem. But when we stop allowing it, that will stop being the barrier. That's my 2 cents.
Thank you. Thank you for that. So Jane shared a story that she worked with Maggie Kuhn when she was younger, and now she's a post-boomer still advocating. So Jane, yay to you. Hello, hello. And Cheryl Brown just said, anyone who wants to make sure we keep the momentum going, please contact me. Thank you, Cheryl. So we are near, there's no more questions at this point. We are at the end of the session time anyway. A sincere thank you, Darrick, Eli, and Debbie, for your fast-paced answers and your ability to take, who'd you say, a century plus and consolidate it and make some meaningful thoughts about what was significant and, more importantly, where we're going for the future. That balance of realism, thank you, Debbie, with optimism, thank you, guys. And the fact, as Debbie said, that to make sure we are working to put the puzzle pieces together. And our last comment, I'm going to read it because it's a compliment to all of us. Brilliant and engaging, thank you. So I don't know who that person is, but we like them. Anyway, Maria, are you going to do concluding remarks, or am I sending us off?
Sandi, I think if you can send us off, you've done just a killer job. It's been a very engaging presentation, so I agree with that individual. Thanks, everybody.
All righty. Well, have a good day, everyone. Thank you again, panelists. Oh, you all. Bye-bye. Bye, everyone.